Dear learners, greetings. In this series of drugs which are related to the cardiovascular system, we have discussed about the anti-anginal drug. And after the pain in the heart, we are going to discuss something which is the rhythm of the heart. Now, please understand the anti-arrhythmic drug I am talking about in this particular video lecture. Now, anti is opposite to the arrhythmia, that is rhythm. The heart is functioning with a definite rhythm. There is lub dub, lub dub, lub dub. A definite heartbeats are there, isn't it? So, and there is a definite sequence is there. There is definite rhythm is there. So, what is that rhythm is? So, once you understand the rhythm, then anything which is away from the rhythm, that is anti-arrhythmia. Please understand. As you can see in this particular diagram, that is the heart, and in this heart, you see, I have shown few of the parameters so that you will understand. In this heart, there is the first part which we call it as the sino-auricular node. This sino-auricular node is present in the atrium, right? Now this SA node generate the impulses. What is the basic function of the heart? Is to pump the blood, right? So for pumping the blood, the cardiovascular, the muscles are there, so that muscles need to contract. So first, atrial contraction. So for contraction of the atrium, what is required is this particular, the sino-auricular node will generate the impulses. These impulses, as you can see here, these impulses pass on to the atria. And once they pass on to the atria, what is happening? This side, this side, this side, all the both the atria. So what will happen? There is a contraction of the atria because of the depolarization generation of the action potential that you know. So first thing is, for the contraction of the atria, the SA node will generate the impulses, and these impulses will cause the contraction of the atria. Sorry. And then these impulses are passed on to the next part. These impulses are passed on to the next part, and this one which I have shown in the red color, that is the AV node. What is happening? From this SA node, the impulses are coming to the AV node, and this AV node will pass on these impulses, the generated impulses, through the, now check this yellow part got with the tree like the roots like structure you are saying. This is the bundle of His and Purkinje fibers. They are completely covering the ventricle part, right? So what is happening? The impulses which are coming from this AV node pass on through these yellow colored the Purkinje fibers and a bundle of His. The impulses are then coming to the ventricle. So there will be the ventricular contraction will be there, and thereafter again the ventricular relaxation will be there. So this is what the heartbeat is there. So in short, what I just wanted you to understand is the heart is working in a specific rhythm. SA node generate the impulses given to the atria, then depolarization, generation of action potential and the contraction of the atria takes place. Then these impulses are given to AV node, and the AV node will pass on these impulses to the Purkinje fibers and the bundle of His, and there is a ventricular contraction is taking place, isn't it? So this is what a specific rhythm there are. This is the specific rhythm we are talking about, right? Now what happens, please understand, in case of cardiac arrhythmia. What is this? Cardiac arrhythmia. Now in case of this cardiac arrhythmia, What is this? This is again a. A refers to what? This a is referring to the no, isn't it? Cardiac arrhythmia. So in case of cardiac arrhythmia, that is a and then rhythm. There is no rhythm. No rhythm means what is happening? You check in this heart structure. See, here it is simple. The sinus node, the generation of the impulses coming to the AV node, then passing it to the bundle of his Purkinje fibers. This is a normal heart. Understand? So simple, the automaticity, that is the generation of the impulses are perfect. If in this automaticity, that is the generation of impulse, if there is something abnormal, check in the second diagram. In the second diagram, you would be in a position to understand well. See, here you see there are so many impulses which are generating. Not even from this SA nodes, there are the magnitude of the impulse is very high. Check here. Understand? Even see here, the magnitude of the impulse is very high. Magnitude of the, that is atrial fibrillation impulses are there. Chaotic signals. From anywhere the signals are coming, the magnitude is more than required or less than required. Understand? And the ventricular impulses are very rapid impulses are there. So that the normal rhythm, the normal automaticity of the impulses is not there. What I just wanted you to understand is the automaticity. What is automaticity? This is one part of the rhythm of the heart. Automaticity is there is a perfect impulse generation of a definite millivolt, understand? And that impulse is passed on from one part to the other part, understand? Now, if there is something abnormal in this automaticity, there is arrhythmia, cardiac arrhythmia. Even in case of the conduction, where from where to where it is conducting, you know that now SA to AV, AV to bundle of his Purkinje fibers, isn't it? So if this sequence is not there, check in the second diagram. From the first diagram it is clear. You can see here. From here, I'll just change the color so that you will be in a better position to see it. See this. In this case, from SA node to AV node. But in this case, the impulses are not coming from, conducting from SA to AV. Isn't it? So that the rhythm actually the comprises of automaticity, that is the perfect generation of the impulse, conduction, that is perfect sequence of moving of that impulse, and the third is a refractory period. Understand? Even in the, I'll show you that PQRS, the graph will be there, and between the time duration between the atrial contraction and then the ventricular contraction, the time duration between the ventricular contraction and ventricular relaxation, this time period is also important. So everything is in rhythm. See the beauty of nature. Everything is in the rhythm. The generation of the impulse, conduction of the impulse, a refractory period, and the time duration between any two events. So all these things are in the rhythm. If there is abnormal generation of the impulse, if there is abnormal conduction in the impulse, and if there is abnormal refractory period, and if there is the duration of between the two events is different, then it is referring to the cardiac arrhythmia. Atrial fibrillation is one part of it. So this is cardiac arrhythmia. Now you come to know what is this cardiac arrhythmia is, right? Now check this. Normal heart rate, normal heartbeat, and abnormal heartbeat. And I want you to focus on this particular graph first. This is what? P wave. The first part you can see here. It's a P wave. What is P wave? That is nothing but the contraction of the atria. SA node, you remember? SA node is generating the impulses. And then the second part is this part. QRS. This QRS refers to what? This QRS is referring to the ventricular contraction. Understand? And the last one, that is this T wave. This T wave refers to the ventricular relaxation. So this is the perfect graph of P, Q, R, S and T. P is your atrial contraction, QRS is your ventricular contraction, and T is your ventricular relaxation. See in this diagram, you can check in this diagram very clearly here. In the first part, this is the P wave, isn't it? This is the P wave. P wave, that is from the SA node, atrial contraction will be there. Then the QRS wave, that is the ventricular activation of the ventricle, that is the ventricular contraction. And this is the T wave, this is the recovery wave, that is the ventricles are relaxed. Now you see in the graph part, this graph part is very important, isn't it? So if I can show you the first one. Now you know that the normal graph would look like this one. When this is the normal way of heartbeat, so this is the heart is in the rhythm. Now when the heart is in the rhythm, check this, how beautifully the heartbeats are. Perfect. See the gap between the P and R. What I'm talking about is the gap between P and R, Q and T. In all these normal heartbeat one, they are perfect, same in the rhythm. I was talking about the distance, the period between the P and R, the distance between the Q and T. These distances also important thing. In the normal heartbeat, you check everything is perfect. When you move on to the fast heartbeat, by seeing the graph only, just compare it between these two graphs, normal and fast heartbeat. You will come to know, see the distance between the two P waves, the distance between the two QRS waves, the distance between the two T waves. So that from that you can easily understand that it is a fast heartbeat. Fast heartbeat. This is a rhythm. This is not the rhythm. Even check the opposite part. This is a very slow heartbeat. See, even it is slow heartbeat, you can, by just seeing the graph, you can see this is slow heartbeat. This is not the normal rhythm. This is a rhythm. And the last part is, you can see from here, it is the complete irregular heartbeat. That is the distance between the two P waves, first two P waves, and the distance between the, what I'm talking about is, check this one. Here you can see the distance between, see here, it's very less compared to here, isn't it? In case of slow, everything is slow, but in the distance is same. But here in this case, what had happened? Irregular heartbeat. First two, one distance is there between the two P waves, and in the next two P waves, the distance is different. These are something irregular heartbeat. This is something irregular heartbeat. So you come to know that what is normal heartbeat is, what is normal rhythm is, so that you can know that what is fast heartbeat, slow heartbeat, irregular heartbeat. And this rhythm, how you will rectify it? By making the, or converting into the abnormal conduction into normal conduction, abnormal impulse generation, that is automaticity, into normal impulse generation, and that of the distance between these waves same, then we can call it as the heart is in a perfect mode, isn't it? Now if you can see the drugs which are affecting the cardiac action potential, the below part, this particular is your, this one is your normal rhythm. Understand? And this is the graph. The graph refers to what? You know that on y-axis it's a millivolt. Understand? Millivolt. And on x-axis the millisecond. So that this is the graph, and this exactly represent this this voltage current and the how that wave is there. So they are exactly representing the each other. So that there are the different classes of the drugs which you can use for this correction of this rhythm. Class 1 drugs are the sodium channel blockers. So these sodium channel blockers are again divided into the three parts. That is the moderate sodium channel blocker. Beautiful example is a quinidine and procanamides. This is called as a 1A class. Class 1 is what? Sodium channel blocker. Where it is acting on, sorry, you can see in the graph, this part. Class 1 drugs are acting in this part. Understand? Class 1 drugs are acting in this part. So that the moderate sodium channel blockers would be the quinidine and procanamide. Then the weak sodium channel blockers would be lidocaine and phenytoin. And the strong sodium channel blocker would be the flecainide and propafenone. So these are the see from here one drug we are going to synthesis from this class, that is the sodium channel blocker, moderate sodium channel blocker. I'll show you in few minutes. Then next would be the class 2. Class 2 are the beta blockers. Class 2 are the beta blockers. Got it? And the example, you know that propranolol or metoprolol. Understand? Then next would be the class 3. These are the potassium channel blocker. Understand? Where they are acting on at this particular juncture of the your voltage current. See, this is the graph of voltage current versus the millivolt versus the millisecond. Understand this part, and this is exactly overlapping with the graph of PQRS T wave. You know that now. Now these are potassium channel blocker. The potassium channel blockers are, example would be amiodarone and sotalol. Understand? And the class 4 are the calcium channel blocker. You know this now, verapamil and diltiazem. So that these are the various classes of the drug which are acting or which can act as the anti-arrhythmic drugs. Is that clear? So the classes of the anti-arrhythmic drug, what is their mechanism, and what are the examples of it. So that is what the particular your drug is. I mean the classification of the drug is. Now come to the beautiful diisopyramide synthesis. Now let us discuss about the synthesis of one of the class, that is the first class, that is your sodium channel blocker, and this beautiful drug is the diisopyramide drug. Diisopyramide. Now this particular one part, this is what your phenyl ring. To phenyl ring, one CH is attached, so that is the aceto, and so this is phenyl aceto, and this is CN. CN is what? Nitrile. So this entire molecule could be phenyl acetonitrile. This phenyl acetonitrile is going to react with the 2-bromopyridine. Pyridine is what? See, this benzene ring with your nitrogenate. So that is your pyridine, isn't it? So this pyridine, which is attached to the this is first position, this is second position. This is the 2-bromopyridine. So phenyl acetonitrile reacts with 2-bromopyridine in presence of NaNH2, that is sodamide. Now what is happening? You check this part. What is this part? This is nothing but your CH2, isn't it? CH2. Now one bromine and one H. So this HBr is removed to get what? This particular compound. Check this. See, this is your pyridine ring. This is your phenyl acetonitrile ring. Got it? And what is moved out? That is the HBr. Okay, HBr, that is, this is the minus HBr. You will get this beautiful addition compound, right? Now, once you get this addition compound, then we are going to react this molecule with this. This is what? 2-chloro N diisopropyl ethyl amine. Now, I'll draw for you so that you will be in a position to understand well. See, this is the nitrogen. To this nitrogen, what is happening? Check here. CH, CH2, CH2. What is this one? What is this one? So this would be the 1, 2, 3. That is propane. But at the second position, it's a linkage. So it's a isopropyl group. So N isopropyl, and this side also N isopropyl, CH, CH2. Please understand, CH2, CH2. So to this nitrogen, two isopropyl groups are attached. When two isopropyl groups are attached, then what it would be? This is the NN diisopropyl. NN diisopropyl. And this nitrogen, please understand, this nitrogen is going to attach to the your ethylamine. So that is the CH. See, this is one, this is CH2, CH2, Cl. What it is? So this means this is ethyl. This is ethyl. But to this ethyl, at the 1, 2, second position, it is chlorine. So this is 2-chloro NN diisopropyl ethyl amine. Understand? So what will happen? This particular, now here again, here at this position, one H is there, isn't it? So this Cl and this H, these are removed to give you again the addition compound. Check this. This is a central carbon. Now to this central carbon, this entire part is attached, isn't it? CH2, CH2. This is CH2, CH2. Next is what? Nitrogen. Nitrogen is attached. And what is this part? This part is your isopropyl part. So this isopropyl part is attached. So that you will get this addition compound. Once you get this addition compound, then it is reacted with the sulfuric acid and the compound is converted into amide. So this is the nitrile group. Nitrile group is converted into amide. And this amide, when reacted with the phosphoric acid, you will get the phosphate salt. So this is your final compound. What is this? The final compound is diisopyramid. Diiso means what? Two isopropyls are there. Two isopropyls are there, isn't it? Two isopropyls are there. Diisopropyl. Understand? So this is a diiso. Pyridine ring is there. So that there is a pyridine ring, right? So that it is a pyridine is there. And last part is what? Amide. This is the amide. Understand? So that while you are discussing about the structure, the final structure I'm talking about, that in that case you should be in a position to understand it well. Check this. This is your final structure, isn't it? In this final structure, what is the compound name? Diisopyramide. Got it? Diiso. What is the diiso? This one. This one. This is the isopropyl. Diiso. Iso comes from what? Isopropyl. Di is what? This di. Two di. So this is diisopyra. Pira is from, this is pyridine ring. So that is a pira. So diisopyramide. Amide is what? CONH2. So that how we have synthesized this compound, that I think you have come to understand now. That is the phenyl acetonitrile when reacted with the 2-bromopyridine in presence of sodamide, you will get an addition compound by the releasing the hydrogen bromide, and then it reacts with the 2-chloro NN diisopropyl ethylamine to give the beautiful addition compound with the central carbon isn't it? And then with the sulfuric acid, the cyano group, that the nitrile group, is converted into the amide group, that is CONH2. That would be your diisopyramid group. Understand? So this, the word itself says that a synthone approach you should always look out. That is a diiso, means what? Diisopropyl group is there. Para is what? The PYR. The para is the pyrimidine, that is the pyridine ring is there. So that pyridine ring is there, and amide, that is the CONH2. So this is what the synthesis of your diiso pyramid. Thank you.